Hello, everyone. All the students are welcomed in this session. I'm Dr. Mehwish with you in the free webinar we're conducting. Walaikum Assalam, Dr. Majida. Hope everyone is fine. Again, welcome everyone. The topic today, which we're going to discuss, you all already know that it's acid-base balance and arterial blood gases interpretation. And you all come across with these kinds of patients in your emergency duties and in ICU duties and during your labor room duties that doctors, they have to check the results of EBGs. Just a minute, guys. A lot of students are waiting in the waiting room. I have to allow them in the meeting. Give me a minute. Please take care of your mics, doctors. Make sure everyone has turned off their mics. Dr. Misana, please check your mic. I have to fix this mic setting first so that we don't find the noise here. Just a minute, please. Okay, let's start. So guys, what today's discussion is about, all of you have joined this meeting in a hope that the topic acid-base balance will be easier after attending this meeting. And after attending this meeting, there should be some benefit for the student. And that benefit is all about learning that what are the basic definitions which we need to learn about this topic. What are the concepts you have to build? Also, guys, stepwise learning of acid-base disorders, how to interpret the results. And we will practice some questions also so that you all know how to solve the questions and get good score in the exam as well. Firstly, tell me that how many times, guys, you have to check your mics. You have to check your mics after joining the meeting, please.
According to the
Someone is suggesting, Dr. Hina, that recording will be there. So, Dr. Hina,
Bluetooth headset, huh?
I have to mute this student. And if I keep on muting students, doctors, how will I teach this topic? Okay, I just hope students take care of their mics and save my time and save everyone's time. Thank you. Let's jump to learning the definitions. Let's jump to learning the definitions. Firstly, guys, tell me, why do you have this understanding of acid-base balance or imbalance or disorders? What do you think? What is acid-base balance in the body? I want to hear from you. Although you can read the definition given, but I really want to hear from you, or you can write in the chat box that what do you think? What is acid-base balance? All right. So the balance between production and elimination of hydrogen ion is called acid-base balance. A very, very easy definition you have got here, that the balance between production and elimination or the excretion from the body of this H plus ion is called as acid-base balance. We're not going into the details of this production and excretion because here this is this is the lecture, this is the discussion for MRCOG-1 students, and I don't want you to spend unnecessary time on the minor details of this topic, how they ask questions in the exam and what kind of knowledge you require for solving that question. It will be the focus of our today's discussion. So we are not going into the details that are unnecessary for students of MRCOG-1, but everything which I've summarized in this session is very important. It's very, very important for you to learn. So chemical buffers, guys, respiration, and some renal mechanisms are responsible for this balance. So learn that these three things are responsible for acid-base balance. If they are responsible for acid-base balance, it is a possibility that if any of these is disturbed, then there will be an acid-base disorder. Okay. And what are arterial blood gases? Where in the body you can find arterial blood? Where in the body? We know that arteries, they have oxygenated blood only in the circulatory system, and it is found in pulmonary vein, left chambers of the heart, and in all the arteries of the body. Is this correct? Is this true? Are you following? Yes, it's very simple to understand. And if you extract some of the blood, if you extract some of the blood from any of the artery in the body, what are the two most common arteries you can get a sample of arterial blood from? Or have you seen any of your seniors or colleagues taking that sample? Or if it's you who is practicing, yes, very good. Radial, Dr. Majda, and femoral, very well done. Radial and femoral are the arteries from where you can take the sample for taking ABGs. Now, these arterial blood gases, they provide us the following information why we are following the blood and we're taking the samples. We want to know the status of oxygenation in the body. We want to know if there is adequate ventilation in the body or not. And we also want to know acid-base levels, right? That is why we are collecting this information. That is why we're collecting the sample of arterial blood. Then, guys, here we are learning, we are making a concept, and you should know very well, or else you can say you are revising this, that what is pH? Actually, pH is the level of the hydrogen ion, which should be in the balance in the body, which we studied, that acid-base balance, acid-base disorders. Those are all related to this H plus ion in the blood. So pH will present the levels of that H plus ion. And there is a range. There is a strict range. There is a specific range of normal human body. Normal physiological pH range is 7.35 to 7.45. And it is very, very important that body keeps itself into this range. For the pH, body keeps itself into this range. We don't want an exceed from 7.45 and we don't want a drop from 7.35. We want this accurate range. Now, if there is a decrease or an increase, and we know that these two are disorders, we don't want these disorders, but there are circumstances in which body is presenting this way. So a decrease in pH will be acidosis and an increase will be alkalosis. Again, we are revising everything you have studied in your school life, everything you have studied in your medical school life. So this is just, we are doing that thing I said, concept building. Every slide is strengthening this concept. So keep your attention level very high. Guys, if there is any derangement, if there is any derangement in the pH levels, we call it alkalosis and acidosis. And further, we have two types. Further, we have two types. We have respiratory causes and we have metabolic causes. We all are already graduates. We all know that what can be respiratory causes and what can be metabolic causes. We will definitely go into the detail of these, but still, if you know nothing about the respiratory and metabolic, the word itself is indicating that something which is related to respiration, something which is related to lungs activity, or something which is related to pulmonary diseases can cause these two disorders, alkalosis and acidosis of respiration, from respiration. And if something is coming from kidneys and the levels of the blood, the levels of carbon dioxide and bicarbs in the blood are disturbed, and these problems are coming from metabolism. Sorry, this should be metabolic acidosis. It's a mistake. So this is metabolic acidosis. Respiratory alkalosis, respiratory acidosis, metabolic alkalosis, and metabolic acidosis. These four disorders will be our mainstay of the discussion. Why I'm not adding compensatory disorders into this? Because RCOG is not very much fond of giving you questions from compensation related disorders of ABGs or acid base balance. Why? Because they feel that this is not a medicine exam, this is an ops kind exam, and very complicated scenarios related to compensation mechanisms are actually not a part of this syllabus. So it's actually a good news for the students. Now, guys, further we are developing our concepts, and I want you to understand that what are the details of respiratory alkalosis and acidosis and metabolic uh, acidosis and alkalosis. So let's start with the respiratory alkalosis. First thing which you need to understand is this. The pH level was high, so it's an alkalosis and related to respiratory. So levels of carbon dioxide are somehow involved in this. And these carbon dioxide levels are acid actually. CO2, carbon dioxide is acid. Okay. If it is very much high in the blood, then acid will be high in the blood and that will be acidosis. If it is getting low in the blood, that means the acid level will be low in the blood and it will cause alkalosis. Why it happens whenever there is rapid uncontrollable breathing? We call it hyperventilation. So what is the function of the lungs, guys? What is the function of the lungs? Tell me, what is the basic function of the lungs related to this gaseous exchange? Okay, use the chat box. Ventilation, good, Dr. Amir. And this ventilation is basically allowing, yes, say, oxygenation and excrete. Is this a good word? Exchange of gases, very good. Inhale oxygen and exhale. Exhale is a good word. Carbon dioxide, Dr. Majida, very good. You have got the point. What I'm asking here is that what lungs are doing with carbon dioxide. So lungs are exhaling or washing away the carbon dioxide from the body. Okay. Lungs are washing away the carbon dioxide from the body. So this is their main function. Lungs, I'm repeating, lungs are, remember this word because it will make a basis of this topic into your brain. They are expelling the carbon dioxide away from the body. Okay, focus on this thing. Uh, if lungs are not performing this function, then this carbon dioxide will stay in the body. Okay, And if lungs are overdoing this function, okay, remember, if lungs are overdoing this function, they will cause a fall of carbon dioxide in the blood. Just like pH, we want carbon dioxide to stay in normal limits in the body, just like pH. So if any situation is making it above the normal limit or below the normal limit, and the cause of this derangement is the lungs, we call it respiratory alkalosis, hyperventilation. Okay, tell me, if I'm sitting here and right now, if I'm getting a news which is kind of sudden, just a minute, just a minute, guys. I will request admin to let me share my screen. Guys, you have to give me a minute, please. So I hope my screen is now visible for everyone. Okay, great. Some technical issues are totally unavoidable and definitely they interrupt the flow of the meetings, but we can't avoid them. Okay, let's revise this thing that we were talking about, the role of lungs in the, I'm drawing that thing again. Lungs, they are working to wash away the carbon dioxide. Okay, so if the levels of carbon dioxide are deranged, that means lungs were not performing their functions accurately. Okay, if they are causing an increase in the carbon dioxide in the body, an increase in the carbon dioxide in the body, we call it acidosis. If we have extra carbon dioxide in the body, because we decided that carbon dioxide means acid. Okay, dioxide means acid. If this acid is exceeding its normal limits in the blood, we call it acidosis. And if the cause is lungs, cause is respiration, cause is a lungs disease, we call it respiratory alkalosis. Sorry, respiratory cause. And if this carbon dioxide is getting low in the body, and again the cause is lung, then the left will be base. What will be left in the body if the extra, if a lot of carbon dioxide is washed away from the body, there will be base. And that base, we call it alkalosis, so that will be respiratory alkalosis. And hyperventilation is the main cause of this problem. When we do hyperventilation, I'm sitting here this is where we stop the discussion. I'm sitting here, and if someone is coming and telling me a very bad news, I will become anxious, I will be in pain, and I will start hyperventilating. My lungs will wash away a lot of carbon dioxide, which was required in the body actually. And then the state, the state of the body will be respiratory alkalosis, guys, respiratory alkalosis. What will be the treatment? Give oxygen therapy. Is this so? We will control the hyperventilation. We will calm the patient. And yes, we will provide oxygen therapy if we find the person in low oxygen levels. Now we will talk about a problem, a problem which is caused by lungs. But here, lungs are not performing their functions so well, and they are making carbon dioxide stay in the body. They are not washing away the carbon dioxide from the body so well that it will stay in the body, and it is totally opposite to what we just studied, and it's present in hypoventilation. When a person is hypoventilating, when a person is hypoventilating, when there is asthma, when there is COPD, a drug can be a cause of this, or pneumonia, and atelectasia, and some other respiratory causes are causing the concentration of carbon dioxide increase in the blood. Okay. And what is the treatment? Treat the cause. You will treat the asthma. You will treat the drug intoxication, and you will treat the COPD, and this situation will be improved. Okay. This is what we say. It is hypoventilation is the cause of this thing. Is this clear? Is this clear so far? Okay, great. Now we are moving towards the other thing, which we say metabolic. Again, yes, Dr. Sadia, carbon dioxide is considered as acid. It's just to make a concept. More carbon dioxide in the body, it will be acidosis, and less carbon dioxide in the body, it will be alkalosis. Just to make a concept, just to remember things, okay? Now, guys, metabolic alkalosis. Firstly, alkalosis again, less number of acid and or more number of base in the body. And the cause will be kidneys or some metabolic disorders. So they are telling you that if there is decreased hydrogen ion concentration or increased bicarbonate, tell me, what is bicarbonate? Bicarbonate is a base, or a direct increase in bicarb concentration. These three causes are considered as metabolic. You can see no respiratory involvement in these three causes. No respiratory involvement, no involvement of lungs. So these are metabolic causes. What can be the cause of metabolic alkalosis? Severe vomiting, anti-suction tube therapy when we provide, and there is extraction of a lot of contents of the stomach, or diuretic therapy. These three can be the causes. What you will do, you will provide electrolyte replacement, and you will treat the cause to treat this condition. Okay. Less acid in the body or more production of bicarbs, iron, and if the cause is related to metabolism or cause is related to kidney, it will be metabolic alkalosis. Opposite to this is metabolic acidosis. Again, the cause will be related to kidneys or a metabolic disease, but a lot of acid will be in the body. A lot of acid. Okay, Dr. Rohan, we will compare these two and I will revise. Increased acid production loss of bicarbs from the body, and what will be left? If there is a loss of bicarb from the body, what will be left? Extra acid. And reduced ability of the kidneys to excrete excess acids. What happens when there is an untreated or complicated diabetes? What is the condition we call, what is that emergency situation? What we call that? Ketoacidosis. Okay, diabetic ketoacidosis. Well done. Well done, guys. So if you have untreated diabetes and there is a load of acid in the body and the cause is metabolic, that is the example of metabolic acidosis. Now, Dr. Rehan, I want you to think about this two lines. Increased acid production. What is the opposite to this? Increased bicarb production. Loss of bicarbonate. What is the opposite of this? Loss of carbon dioxide. And reduced ability of the kidneys to excrete excess acids. And opposite to this is reduced ability of the kidneys to excrete bicarbs. What is opposite to this is metabolic alkalosis. All right. And now I'm showing that slide again. So guys, you can revise. Okay, decreased hydrogen ion concentration will cause alkalosis. Increased bicarbs or a direct increase in the production of the bicarbs will be causing the metabolic alkalosis. Now we are coming towards the main part of today's discussion, ABG's interpretation. Before talking about this, guys, you have to understand three things. You have to keep these three things in mind. What are the normal values? Anything you are interpreting, anything you are drawing a conclusion from, anything which you, just a minute. Students are joining the meeting from some different kinds of names. The student who has just joined is given her account the name Shadi. Okay, welcome Shadi, and I just wish you are here for learning. Hope it's your original name and you have joined from an original ID. Okay, so normal values we require for understanding the test. Then you should know that the deranged values are indicating what? Okay, you should have this background knowledge. You already have got this background knowledge. Like I was reading the slides, I was giving you the concepts, and now you have got that concept. And third, you will follow the steps. Now I will share an incident with you. We were in the house job, and it was like first day of rotation of medicine. Every one of you has gone through this time, and you know that things are not very easy for a new doctor who has just stepped in the ICU, and no senior actually expect from us to, treat the patient, but they do expect from us as a junior doctor that one should have a good knowledge. But in the confusion of the clinical work and so much pressure, students just forget about the basics. So that senior did this kindness to us that he made us. I remember his name, and I will always be grateful to him for this kindness that he made us stand for an hour, for whole an hour. He made us understand the ABGs in a way that for my whole life I can't forget that. In my memory, the method was saved, and now I am, delivering that method to you so that you all can understand and remember and treat your patients in very quick steps. If you make a habit of learning from everywhere and then you follow some very accurate steps and you keep on following those steps for your whole life, then making mistakes and making delays in the treatment is almost impossible. So, before learning the ABG's interpretation in this meeting, just understand that you're not learning this topic for solving the questions in the exam. You are learning this topic also for your patients who you are going to treat, and they are definitely not in very good condition of their health because they are presenting in emergencies and ICUs. So be very careful. Be very careful about this learning. So firstly, you should have a good idea about the normal values. Then you should have a good concept at what the deranged values are indicating, and then the steps should be on your fingertips. Let's move to the main part of today's session. So we spent half of the time of this session on making the concepts, and now we will use these concepts into this learning. So these are the normal values. 7.35 to 7.45 is the normal pH of the body. Remember these words 3545 because 3545 is the normal range for carbon dioxide levels, partial carbon dioxide levels. Then oxygen levels are 80 to 100, and an important one is 22 to 26 for the bicarbs levels. Guys, keep in mind these three are going to help you a lot. These three are going to help you a lot. So if you keep these three in mind, you can solve the questions very easily. pH, carbon dioxide, and bicarb. Now, deranged values are indicating what we have just discussed. That if the pH is normal, we say it's normal, but if it's low, we call it acidosis. If it's high, we call it alkalosis. Carbon dioxide, if it is high, we call it acidosis. If it is low, we call it alkalosis. Bicarbs level, if the bicarbs level are high, we call it alkalosis. If bicarbs level are low, we call it acidosis. But how to make the diagnosis in the questions and in the exams? We have to follow these steps. Firstly, tell me, first 2 points are clear to you? Should we move ahead? Yes, guys. Okay, good. So in the first step, you will look at the pH. Okay. Okay, I'm repeating the last slide. We were talking about the normal values, and we decided that we will also learn that if normal values are deranged, what they are indicating, what they are taking, uh, how we will make a diagnosis from the deranged values. So here we are learning that normal pH range is this green one, and if it is exceeding from the normal range, we call it alkalosis, and if it is low from the normal range, we call it acidosis. Carbon dioxide levels, if they are high, we call it acidosis, and if they are low, we call it alkalosis. And for the bicarbs, guys, if bicarbs are high, we call it alkalosis, and if these are low, we call it acidosis. But it is not true that after learning the normal ranges, you can easily interpret the result from an ABG test. So for that, we have to follow some very simple steps. So have a look on these steps and try to learn that what each step is going to help you. So firstly, you will look at the pH. Why we are looking at the pH? You have to look at this thing. Again, there is a mistake that this is metabolic. You can see that you have, Dr. Miliha, you have to be very attentive at this part of lecture, Dr. Miliha, because you asked this question and I tried my best to explain it here. Okay, Dr. Miliha is with us. So if you see, this is the second part of the disorder, the name of the disorder, and this is the first part. The second part of the disorder you can easily diagnose by looking at the pH. If pH is low, if pH is low, then lower than 7.35, it is acidosis, and this acidosis word will not be changed by any other values of the test. Acidosis will remain acidosis if you find the pH low. And if the pH is high and you have decided that this is alkalosis, then no matter what other parts of the test are saying, it will be alkalosis. The first step is very easy. First step, and diagnosing this second part of your disorder is very easy. Students make the mistake in the second part of the diagnosis, that they make the diagnosis wrong because they fail to learn the basic concept that what is the role of respiratory or lungs in the making the first part of the diagnosis, what is the role of metabolic changes. So that for saving us from making a wrong diagnosis, first part is easy to diagnose, second part and third part and the fourth part, they will make us understand how to make the first part of your disorder, how to diagnose the first side of your left side of your disorder. So you will look at the carbon dioxide levels, then you will look at the bicarbs levels, and then you will match the change of the pH with the levels of carbon dioxide and bicarbs. How you will do this? We will solve 4 questions right after this slide, and you will apply this onto them. Then in some cases, like in some respiratory failure cases, you can find the patient in hypoxic state also, and that is not changing your diagnosis which you have already made. Okay, guys? If the patient is suffering from hypoxemia and you have already made your diagnosis from the first 4 steps, this will give you a result of, just a minute, we have students waiting in the waiting room. Welcome new joiners. It's kind of sad that you have missed half of the meeting, but you will get the recording, and I'm sure the recording will help you in learning the full topic. So this hypoxia state will be assessed by the levels of oxygen, but this will not change your initial diagnosis which you have made. Now, what is base excess? I will tell you. Before solving the questions, before jumping towards the cases of acid-base disorders, we will also learn 2 important definitions. First definition is anion gap. Anion is negatively charged particle in your blood or negatively charged electrolyte in your blood, and cation is positively charged thing. Can you name some of the anions and some of the cations, please? Just mention the names. What is negatively charged particle or electrolyte in the body, and what is positively charged? Very common one, sodium is positively charged, and very common chlorine is the negatively charged, or chloride. Well done. Potassium is the positive one. Well done. K plus is positive. Very good. Phosphate is negative. Calcium is, bicarbs are negative. Okay, good. Well done. That means you have this information already. So guys, whatever you were telling me, the names of the negatively and positively charged things, the difference between these two is called as anion gap. High anion gap is present in metabolic acidosis, and the things which are leading to metabolic acidosis like lactic acidosis, kidney failure, and toxins. And again, we're not going into detail because these are medicine topics. And low anion gap is seen in hypoalbuminemia. So you are here just to save yourself from confusing this anion gap with another thing we repeatedly get in the results of ABGs, and then we are saving ourselves from making a confusion between base excess and anion gap. So the base excess is,
Okay. There is something different.
okay, the base excess is characterized by the amount of base that is required to normalize the pH of the blood. This is the definition. Learn this definition. This is quite different from the anion gap. And the normal values, they are ranging from -2 to +2. And in many ABG results, in the end, they give you this base excess. And again, guys, if you have diagnosed the patient from the first 4 steps, then base excess will support your diagnosis. It will not change your diagnosis. Okay, because it's just uh, the amount of base. What is base? What is base in our ABG's result? What is base? Yes, what is base? Which component is the base? Come on. We were talking about it a few minutes before. Bicarbs, well done. B for base, B for bicarbs. So the level of alkali, the level of base, the level of bicarbs, the amount of bicarbs which is required to normalize the pH. Normalize the pH is called as base excess, and normal values are -2 to +2. Okay. Now let's move to our case 1. Right in front of you is a very easy question. Again, I'm telling you guys, the exam you take, this MRCOG-1, is not an exam for medicine. So they will give you easy and simple questions from ABG disorders, from acid-base balance disorders. So what you have to do is to learn the basic, very simple concepts and how you are making the diagnosis. Tell me, Dr. Sophia, are you following the steps? Firstly, you are following the first step. Well done. Getting the answers. Good one. pH is high, so basic Dr. Sophia is answering. Very good. pH is high, so it will be alkalosis. Very good. And bicarb is also more, so if bicarb is more, well done. If bicarb is more in the blood, it is supporting a metabolic cause. Vomiting itself is telling you that it is a metabolic alkalosis. Very good. It is a metabolic alkalosis thing, and there is a loss of acid from the stomach. In vomiting, there is a loss of acid content from the stomach, and it is causing metabolic alkalosis. But if you go deep into the ABGs, yes, very good. Slightly elevated carbon dioxide is trying to compensate. But still compensation is not done, so pH is not in the normal limits. See guys, you already know everything and you can solve the question very well. And this is another advice from my senior, which I'm conveying to you, that always look at the clinical picture of the patient. In this question, the patient is coming with vomiting, okay, for the past 3 days. So there's a lot of vomiting, a lot of loss of acid content from the body. Okay, so always look at the clinical picture. And in this coming case, the patient is coming with chronic obstructive pulmonary disease. So previously the duration of the disorder was 3 days, and now the duration of disorder is not here, but it's a chronic disease. So we can understand by this word that there is something which is not letting the lungs function properly. Okay? Remember this word. There is something which is not letting the lungs function properly. And he is coming with shortness of breath as well. What is your diagnosis here? 7.35. Carbon dioxide is 55. Is this person retaining the carbon dioxide inside the body? Yes or no? Okay. A lot of carbon dioxide in the body because lungs are poorly functioning and not letting the carbon dioxide wash away. Let's see. Respiratory acidosis, well done. So pH is on the lower side of normal, but still within the reference range. So because this is a chronic, very chronic condition, so pH is not very much disturbed. Carbon dioxide is elevated, indicating respiratory acidosis, indicating a lung-related cause. Bicarb is also elevated, indicating partial metabolic compensation. This pattern is commonly seen in chronic COPD, where patients retain carbon dioxide over time. Very good. This question is from a very important source of SDAs for MRCOG-1. So I've added this. Again, this is still an easy one. A semi-conscious pregnant patient is admitted in labor ward. She has dry skin. She is hyperventilating and rapid pulse rate. Rapid pulse rate is another word for tachycardia. pH is 7.14. Tell me it's alkalosis or acidosis. Yes, low pH is for acidosis. Very good. And what will be the next step? You are looking at carbon dioxide. If carbon dioxide, is this high or low? Okay. And what is the level of bicarb? Bicarb is low, significantly low. Yes. Bicarb is low, but significantly low. 22 to 26. So 14 is significantly a lower number. 30 is not a significant low number. Uh, is there a problem with voice for everyone? Is my voice not clear for everyone, or is this a problem for one student? It's clear. Okay, anyone who is facing this problem of voice, just leave the meeting and join again and it will be okay. So guys, carbon dioxide is still close to the normal ranges, still close to the normal ranges. Now, why they are giving sodium, potassium, and glucose levels? What we are going to do with that? In 3 very simple steps, we are done with making the diagnosis. In 3 very simple steps. Okay? So let's read the answer. The answer is metabolic acidosis. It's a metabolic cause because bicarb is very low. Bicarb is very low, and low bicarb, low alkali in the blood is going towards, it's actually supporting the pH. So metabolic range or bicarb range is supporting the pH more than the respiratory cause. So the presence of decreased pH, bicarb and normal, almost normal carbon dioxide is suggestive of metabolic acidosis. We have still students waiting in the waiting room, and guys, again, I'm kind of sad that you have missed the live discussion, but you will get the recording and definitely you should go through that and learn the topic. Whenever someone is entering, we are Requesting everyone to mute the mics, please, guys, please mute the mics. Thank you. So the reduced bicarb and carbon dioxide ratio shows a widened anion gap. This presence of hyperglycemia and dehydration can lead to significant complication in a diabetic patient. So this is the explanation of this question. We have another one. This is again from a very important source. 32 years woman presents with 2-day history of severe diarrhea. Okay. Clinical history is 2 days of diarrhea. Lethargic and dehydrated, which is obvious. They have performed the ABG 7.32. Firstly, decide what pH is telling you. Then tell me if carbon dioxide is in normal range or not. And then tell me what is the significance of this level by carb. And if you are happily jumping towards the diagnosis, and if you are very much sure, Dr. Asma, actually, they are somehow tricking us by giving a bit deranged value of carbon dioxide in the previous question. So the main and primary cause is metabolic, and we have no doubt about that. Okay, Dr. Sazdia, I'm answering your question about the previous case. Whenever there is more alkali, we call it alkalosis. So whenever there is less alkali, we call it acidosis. This is one point. But how metabolic? Okay. Is there any respiratory involvement in making the pH low? No. When there is no respiratory involvement and bicarb is making the pH low, then it is metabolic cause. Okay. Guys, why you are getting worried about the compensation? I have told you that RCOG, they do not give you compensatory mechanisms in the scenarios. They will give you simple scenarios. Yes, bicarbonate is metabolic. Well done, Dr. Sadia, you have got my point. If there is a little compensatory factor from other system, which is not causing the main problem, you will not mention it in your diagnosis because still the pH is not in the normal range. Yes, Dr. Majida, hint is patient is having diarrhea, but this hint can lead you to make an incorrect diagnosis as well. So you will only focus. You will only focus on the ABG's result, and then you will relate it clinically. First, make the diagnosis from the ABG's result and then look at the clinical picture of the patient. It is very important to look at the clinical picture, but if you are only looking at the diarrhea or the vomiting or the respiratory condition they have given in the scenario, then you can go towards the wrong diagnosis. Okay, good. So metabolic acidosis is there, pH is low, and if pH is low, it's acidosis. How it's acidosis? From the respiratory cause or metabolic, so we will look at the both of the levels. We saw that carbon dioxide is in the normal range, so there is no involvement of the respiratory system, and there is also no no factor of compensation as well. Okay, but bicarb is extremely low, and we say it's a metabolic cause. So where diarrhea leads to the loss of bicarb from the intestine, resulting in metabolic acidosis. So vomiting is giving you what disorder? Is vomiting related to respiratory? Yes, metabolic alkalosis. And diarrhea is metabolic acidosis. All right, guys, this is all from my side, and I just hope that I'm successful in delivering the concepts which are required for solving the questions in the exam correctly, and definitely I'm also successful in delivering the concept of this ABG interpretation, that you are standing in the ICU or in the emergency and you're looking at the results, so you can definitely diagnose the patient correctly, and more medicine topics with us. Dr. Rohan, I'm a doctor for gynecology and I'm a teacher for MRCOG-1 and this is my limit. This is my limit. And definitely we will conduct more sessions on the medicine topics when we will start other courses like for MRCP or MRCS, etc. Then you will have very good webinars and meetings from other doctors. But from my side, we will cover mostly the topics which are related to gynecology or are required in the. Yes. Okay. We will arrange that. Definitely. We are discussing in the group and we will arrange meetings for that as well. So thank you so much everyone for joining, and I just hope that from now in your whole life you have made this concept and you will revise a bit and then it will be in your memory for lifetime, inshallah. Thank you everyone for kind words. Thank you so much, and if you have any question you can ask. Dr. Sophia, I will excuse from today's discussion in the group because you all have attended this meeting. I have conducted this meeting, so we need a bit of rest. But yes, Telegram recalls. We are not taking a break at all because 9 p.m. is the time. Yes, we will definitely conduct the course discussion recalls. You will get the recording in the group, Dr. Naseem. Dr. Sadia, the next class will be announced. It will be in the next week, inshallah. And it's on a very interesting and very important topic for MRCG1. It's female reproductive tract endocrinology and physiology. So you all are advised to attend that because that will be inshallah very informative and important discussion. I have announced the topic, but I will give you the date and the time very soon. Everyone is advised to attend the recalls discussions on the Telegram group on time and don't miss a single one. If you can't attend it on the given time, you can read the discussions after a few hours, but finish the work daily and follow the schedule. Okay, dears, it's time to finish this session. Again, thank you so much for attending. See you all in the classroom. Bye. You have to, Doctor, from the iPhone, you have to send a message on my WhatsApp or the number which is given on the screen, and you will get the details of joining the Telegram group. Dr. Sadia is the part of the January 2025 study plan, and recalls always are started already. You can join by taking the details from the given number. You can see the number on the screen, or else this is the number you can knock. You can get the details of this group from this number I have shared in the chat box, or else use the number given on the screen. Okay, see you students. Bye.